Hi everyone, Scott here from BetterHealthGuy.com. Thanks for joining me for a Better Health Guy blogcast. First, I want to say that everything in this discussion is for informational purposes only. No comments are intended to diagnose, treat, or cure any condition. As always, discuss any potential health-related decisions with your own personal medical authority. Our guest today is Dr. Michael Lebowitz. Dr. Lebowitz has practiced applied kinesiology since 1980. He was the first in muscle testing to create methods to treat dysbiosis and other microbial imbalances, chemical and metal toxicity, hypercoagulation, as well as many other common findings in the chronic patient. He's developed many specific supplements to help with the complex patient, as well as energetic testing vials used with applied kinesiology. He continues to treat people from around the globe, as well as teaches techniques to physicians, writes books, produces protocol DVDs, and publishes a free monthly newsletter to over 2,000 physicians that have studied with him. He is a consultant to Supreme Nutrition Products with a focus on assuring product quality, and I've had the opportunity to learn from Dr. Lebowitz for the past several years, and I'm very excited to have him here today. Welcome, Dr. Lebowitz.
Thanks, Scott. Good to be here.
Thank you. First thing I wanted to touch on was food and how food helps us heal or holds us back. So I know you have a unique way of looking at food toxins, and I was wondering if you could talk a little about how you assess a patient for food-related stress, some of the more common food stressors that you identify, and how important is it for people to avoid food stressors in order to optimize their healing program?
Okay, a lot of what I'm going to talk about with foods comes from a kinesiological standpoint. I mean, we have done labs for foods to test for sensitivities. They can be very useful. They do change fairly often in some people, so that it's not that cost effective to utilize the labs. But when we were testing for foods, we found that often a person would be reactive to a food even though it wouldn't show up in our tests. And we began to wonder why, and we realized that if there's a substance in a food that could potentially be toxic, for instance, alpha-solanine in the nightshade family, there's also beneficial products in the foods. Like in tomatoes, there might be alpha-solanine, but there might be lutein and vitamin C and vitamin A and so forth. And so when you muscle test, the two things might neutralize each other, and the food substance might test fine, but once the body starts breaking down the food into its individual components, it'll start reacting to the toxic components. Mm-hmm. So we started getting samples of some of these, what we're calling food toxins, caffeine and its breakdown products, paraxanthine, theobromine, theophylline, zein, solanine, casein, albumin, gliadin, etc. And when we started utilizing those, we found that for some of those substances, probably 60 to 80% of our patient load had some type of adverse reaction to them on testing. And when we started removing them from their diets, things improved tremendously. We also found that if you're trying to clear other things like dysbiosis and toxic metals and so forth, if they continue to eat these foods that had these toxins in them, their body would usually just be tied up in some type of inflammatory reaction. So you wouldn't get quite the therapeutic effect of the supplements and all the therapies you're trying to do just because of this acute inflammatory reaction going on.
So this is a huge, big deal for people that have chronic illness. If they're not changing their diet, they're probably kind of minimizing their chances of really getting the health that they hope to attain.
Yes, even though it might not be always the underlying cause, we did find that if you don't remove them from the diet, it's very hard to get to the underlying cause. And by removing them, you get the quickest positive symptom change in patients.
Okay, great. And how do the foods that people eat, how does that potentially tie into someone's ability to hold a chiropractic adjustment? I know chiropractic is your background, and so does this affect that as well?
When I teach, I usually say the major cause of chiropractic subluxations is food.
Okay.
There are lots of people who have to go to the chiropractor repeatedly, multiple times a week. And on quite a few of those people, if we find the foods they're sensitive to and remove them, suddenly the 3 times a week chiropractic patient becomes a twice-a-year chiropractic patient.
Yeah, that's pretty amazing. It's hard to believe that it's so significant, and yet I know that it is. So I hope that people listening will hear what you're saying and really think about what they're eating. I know a lot of people with Lyme and other things that are still, eating sugar. And, I know with your system of testing, caffeine is a significant one. In fact, maybe you can comment on that a little, because that's one that I hadn't thought of much before I had started learning your work. And I know that caffeine is a pretty significant one for a number of people.
In our testing, caffeine tests adverse in probably 90% of our patient load, and it has an interesting reaction. Instead of causing muscle weakness, most of the time it causes muscle hypertonicity. So it actually makes the muscles get tighter than they should be, and you could see how that could theoretically cause chiropractic issues, and lots of other issues too. And to me, it's almost criminal that things like coffee and chocolate are the new health foods. And you go into some of the big health food markets and you can have a whole row of those products. They do have some positive antioxidants and so forth, but the negative reaction of caffeine on the muscles and the adrenals and so forth, in my opinion, way outweigh the positive effects.
Yeah, very interesting. Thank you. Do you have any thoughts on what type of diet is potentially the most healing for people? Is there any way to kind of generalize the things you see commonly beneficial?
I don't see anything general other than some type of whole foods diet, that's organic. Some people, when we test them, seem to benefit more going in the paleo direction. Some people tend to benefit going more in a vegan direction. It just depends on the person and their genetics and all the other variables that are affecting their health.
Yeah, okay, that makes sense. So from a detoxification perspective, we live in such a toxic world with metals and chemicals and pesticides and so on. So wondering if you could talk a little bit about some of the solutions that you find helpful for detoxification. And I know, one of them is Taka Sumi Supreme that I personally have used for years and found very, very helpful. And I know you have some things you've shared at past conferences about how that Taka Sumi has been used in Europe and different food products and things, which might be interesting for people to hear as well.
I mean, obviously, the first thing to do is not live in a toxic environment. And most of us are aware of, there are alternatives in cleaning products and flooring and paints and so forth that you could utilize in your house that'll be helpful. In terms of detoxification, from a product standpoint, like you said, Taka Sumi Supreme is kind of a all-encompassing detox agent that they've been using in Japan for a long time. They've used it in Indonesia in some alternative cancer treatments. I did read where they used it in the United Kingdom, and they'd make spoons out of it to stir in the coffee. It would tend to make people tolerate the negative effects of the coffee better. My son, who lived in Japan, started baking it into bread. And other than that the bread would turn black, it would actually taste better. And a lot of the gluten intolerant people were able to tolerate it much better if Taka Sumi was baked into the breads.
Now I'm going to get people asking for the recipe for the Taka Sumi bread.
I'm sure Josiah would be happy to share that.
Yeah, that's great. Fantastic. So since we talked a little bit about Taka Sumi, how do you generally like to see people use it? I know some people try to keep it a couple hours away from food and supplements. I know some people take it with food. Some people take it half an hour before food. Is there an ideal way to utilize that tool?
I did have a few patients who were taking it at the same time they were taking the magnesium that they needed, and the magnesium became less effective. And so as a result, we decided to just keep it maybe an hour before eating or 2 hours after eating and away from medications. It might be able to be utilized closer, but just to play it safe, that's how we've been using it.
Okay, great. That's helpful. And what are your thoughts about exposure to mold and mycotoxins? A lot of people are living in homes, working in environments, going to school, maybe their car, that have mold-related issues. And so how significant do you see this, and how do you kind of approach addressing it?
In terms of how significant, it's incredibly significant. We're in the process of moving this week. Actually, tomorrow we're moving because it's very hard in Hawaii to find a house that's over 20 years old that doesn't have a mold problem just because of the climate. And so we're moving to a house that's 6 years old as opposed to our present house, which is 25 years old. Um, and I've seen patients who could not get well as long as they were living in a moldy environment because you're breathing in the mold, and you have to think, what environment does mold like to live in? It likes to live in warm, wet, dark environments, which the inside of your body is. So
Hmm.
you're going to basically have mold, which we'll call fungus, when it's living inside. You know, you're going to keep breathing it in. It's going to keep growing inside of you, and you'll have this internal dysbiosis. And these molds can produce aldehydes and benzene and other toxins. So it's almost like suddenly you have Monsanto living inside your body.
Oh boy. Yeah, that doesn't sound so good. Okay, great. In terms of toxins, I kind of see electromagnetic fields as another toxin that we're exposed to as well. So do you see that as something that's also important in patients? And are there good ways to kind of approach the EMF impact on health?
I mean, EMFs are definitely important. It's a little hard to say how important. What I've noticed is the people that are exposed, the people that have toxic metals are much more sensitive to EMFs than the people that don't. Maybe something to do with the conductivity of the metals. Also, we found clinically that it appears that the EMFs tend to lower your pyridoxal 5-phosphate levels. And if they're lower, you're more prone to inflammation, you're more prone to food sensitivities, and all the other, P5P is necessary for neurotransmitter production and, a whole host of other things. So, it's definitely important that way. A friend of mine did some studies with petri dishes and found that in a high EMF environment that certain funguses reproduced a lot quicker. So it could perpetuate dysbiosis also. So it is very important.
I wonder if that's even potentially a reason that so many homes now have mold issues, that there's more EMF environmentally, and if there's a small amount of water damage, I wonder if that helps it to also proliferate in some way. It's
It does.
interesting.
It does. I mean, when we were house hunting this time, we basically did two things. I mean, I don't care what the house looks like. My wife does. All I care about is what the mold is like and does it pass my EMF meter readings.
Awesome. Yeah, that's great. Anything that you found other than kind of changing environments from an EMF perspective and measuring the environment, anything that kind of will support the body? Does it make sense for people to take P5P if that's affected, or no?
Um, we did come up with a product many years ago called Bodyguard Supreme. And the way that that was found was we started exposing patients to high EMF environments, and we blindly tested about 100 different herbs to see if there were any that seemed to block our positive finding. And the herb in Bodyguard, which is a Philanthus species, tended to do that. We're thinking it helps by perhaps it doesn't block EMFs. All it does is it strengthens the parts of your body like the pineal gland that are helpful in allowing you to tolerate them better.
Okay.
So we do use that. I mean, in this place we're moving into, there is a big EMF tower nearby, and I'm thinking of getting one of those hats with the silver fiber in it to block it. I have noticed that most of the things that you put on your cell phones, those little gadgets, don't seem to really work that well.
Hmm.
There are some things like Defender Shield and a couple of other companies that put out whole cases that block.
Okay.
You can talk through them, and those definitely help to some degree.
Nice. Yeah, that's great. Thank you very much. So I know from some of the courses of yours that I've taken in the past that you've really developed some observations from your work with the muscle testing. And one of the things that was interesting to me was, assumptions that people have about certain supplements that are always assumed to be good or always assumed to be bad, that your kind of observations from the muscle testing had some interesting insights. So I'm wondering if you could talk about a couple of those.
Yeah, I mean, there's lots of great literature on a lot of different substances out there, nutritional substances. And when we've been testing people, we found that a lot of them didn't pass our kinesiological tests. We always wondered why. And also a lot of substances that maybe 20, 30 years ago tended to test pretty well aren't testing well at this point. It's a little bit hard to draw conclusions. We think that part of it is a lot of the manufacturing process for nutritional supplements has gone overseas, with a lot of it coming from China.
Okay.
It could be that there were solvent residues in these products, or who knows what else. When you get the certificate of analysis from the companies, they only check for a few things. So it could be that there are some contaminants in there. Also, most people's bodies don't do that well on an isolated nutrient. I mean, in nature, it doesn't exist that way. And they tend to do better on whole substances like herbs and so forth. And it seems that over the years, now that we test, very sensitive people that have Lyme and all kinds of other interesting things, it's very rare that we find things like multivitamins test very well. They seem to do more harm than good in a lot of people, and it would be better to give them some nutrient-dense foods and only rely on the isolated nutrients when we need them for genetic reasons. If you have methylation defects, maybe we need to give some 5-MTHF and methylcobalamin and so forth. Or maybe if you are exposed to high EMFs all day long, we should give a little bit of pyridoxal 5-phosphate. Or if you worked in Nordstrom's in the perfume aisle, maybe you'd need some molybdenum and selenium to help with the aldehyde pathways. But in general, either from a quality standpoint or just people are changing so dramatically, we've tended to shy away from them much more than we used to, and our testing seems to confirm that that's a good idea.
So any thoughts on fish oil and or vitamin D? Do you find those test well generally, or not so much?
I find with fish oil that if there's liver stress in the patient, it tends not to test well. And another thing is if the person has mercury toxicity, fish oil, even if it's mercury-free, doesn't seem to test well. And I think what happens is the body makes an association. If it's used to getting its mercury from fish, what happens is when you take the fish oil, I think your body goes, uh-oh, fish is coming in, mercury's coming in. It's like that old experiment that they did with rats where they bred these allergic rats, and every time they fed the rat a food that they were allergic to, they rang a bell, and the rat would have this allergic reaction, and eventually all they needed to do is ring the bell for the rat to have the allergic reaction. I think our body does that same kind of conditioning, and we can end up reacting to some supplements because of that, especially fish oil. In terms of vitamin D, in the beginning, I never found vitamin D to test well. And I'm revising my opinion there because a lot of times it does seem to test well if you take a liquid vitamin D and apply it to the skin.
Oh, interesting. Okay.
And that what's interesting is after you apply it to the skin for a few days, then it'll test well orally. But it's almost like the body didn't know what to do with it until you started testing that way. So I have been finding vitamin D not in a ton of people, but definitely in a lot more people since we've been testing in that fashion.
Yeah, that's a great tip. So I know you mentioned a little bit with the multivitamins. I know that you have a preference for products that are essentially single ingredient and don't have 10 or 12 different things. So is that because there may be one or two things that someone would react to, kind of like the food issue that you were talking about earlier with the tomato?
That's part of it. Like, let's say you wanted to treat some microbe, like a fungus or a parasite, and you go and you get the anti-parasitic or antifungal product that has 20 different ingredients in it. Of those 20, there might be 2 or 3 that are actually effective for your condition, and maybe 17 that aren't. And, most of these herbs that are strong enough to kill microbes, your body only wants during certain circumstances. So it might actually be adversely reacting to some of those others. So that can happen. And at the same time, even if your body needs 3 of those 20, since that only potentially makes up 15% of that product, you won't be able to get a high enough quantity of those in there to get a optimal therapeutic effect. So with the testing we do, we might give 2 or 3 antimicrobials, but they're ones that singularly test. So we're actually making our own combination from the different antimicrobials that we test. And a lot of times we can get by with one, because with herbs, most of the antimicrobials are broad spectrum. Herbs typically aren't just, they only are effective against Candida or only effective against Giardia. They're usually fairly broad spectrum. Some of the really master herbs like Malia, which is neem, or Morinda, which is noni. A lot of those are very broad spectrum and cover the whole gamut of microbes.
Yeah, and a lot of times I even wonder if we're helping support the body against things that we don't even know about with those tools, right? I mean, things that don't even have names in the medical world yet that probably are also being addressed by the broad spectrum herbs.
Oh, definitely. That's why I think when you start refining the natural products into, like you take coconut and you refine it into caprylic acid or different things like that, the more refining, the more narrow spectrum it's going to be.
That makes sense. So let's talk a little bit about some of the microbial issues that you see in patients. How often would you say that you see Lyme-related stress in a client? And do you think that most people have been exposed to Lyme by now, or at least the organisms that cause it, and they just don't manifest disease? Or what are your thoughts about the prevalence?
For Lyme specifically, on patients that I am able to follow through over, a given year or two, I'd say the majority of them at some point will show for either Borrelia or one of the co-infections in our testing. I think pretty much everybody's been exposed. I think everybody was exposed before. I just think that our bodies are weaker, so these different things that our body was able to hold in check before were just not. So things that are more opportunistic are manifesting more as symptomatic these days, just because of all the EMFs and chemicals and vaccines and GMOs and everything else we've talked about. Our bodies just aren't able to keep these microbes dormant like it used to be able to.
Yeah, I would agree. I think that makes total sense. So in the world of Lyme and chronic infection, I think there are practitioners that focus on treating, Babesia before Bartonella, or this organism before that organism. What are your thoughts about whether or not we need to consider all of the microbial stressors at once, or does it make sense to focus on a specific thing at any point in time?
Well, I think really they could only do that if they're treating with pharmaceuticals. Because if they're treating with plants, the plants are going to be more broad spectrum. Even if one's called a Babesia formula, it's not going to be that narrow spectrum. Mm-hmm. So they're going to be more broad. I feel that with different forms of both Lyme and its co-infections and funguses and parasites and so forth, if you narrow your approach to treating 1 or 2 things in there, basically you're going to upset the balance. I mean, you might get rid of some fungi, but then the parasites might proliferate. So I think it's much better to give broad spectrum, non-toxic substances that can cover the whole gamut, and then you find symptomatic change much quicker.
Yeah, that makes total sense. When you see people with Candida that doesn't seem to clear, what are some of the things that you look for? And then what's the role of other people in the family member, sexual partners, or so on? What role does that play in terms of re-exposing someone to microbial stressors?
Okay, instead of Candida, let's talk about fungi in general.
Okay.
It's very rare that we have patients who, according to our test, don't seem to clear. And that's because of some of the things you talked about. When we check someone for these things, we want to check anyone they're sexually involved with. Because theoretically, even a kiss or any type of passing of body fluids, you could reinfect. So we tend to check spouses or sexual partners. We check the house air to make sure it's not infected with mold. We might check pets, especially if the pets lick the people, or they sleep with them. We've definitely had people where if you didn't treat the pets simultaneously, the patient wouldn't clear. But if you get the people off of the foods they're sensitive to, so their body can really focus on the problem, and you give them the specific herbs that they need, and you take into account their, again, the variables we just mentioned, usually clearing is quite quick.
Okay. Yeah, very, very good information. I've heard people debate whether or not those with fungal issues should or should not use kombucha, and I'm wondering if you have any thoughts or insights about that. Is that good for us or not?
I don't think anybody should use kombucha.
Okay.
Just from a testing standpoint.
Uh-huh.
I mean, we were around back probably 30 years ago when people were, at least seemed to, in the health community, start experimenting with it. And some people did get very good symptomatic change, but it almost seemed like they were, getting the kombucha might have been eliminating one microbe, but the kombucha was like a mystery microbe that you never knew, like down the line, what it might end up doing. And because of my uncomfortableness with fungi causing havoc in people's bodies, I tend to shy away from it from that standpoint, and again, from a testing standpoint.
Good information. Thanks. Parasites seem to be such a common issue these days, and so any thoughts about why they're so common and why are we seeing them so frequently in people, and then how do you approach addressing parasites?
There's a couple of reasons. One, again, is I think we've always had them, but our bodies are weaker and they're manifesting more. But more important, we have a much more global society. And so, if we have a certain ethnic background, we might have developed some resistance to certain parasites over time. But now, you might go into the restaurant and the person, who works back there preparing the food might be from a totally different part of the world, and they might harbor a different microbe that might get into the food from their food prep, and then you ingest it, and it'll end up you don't have any resistance to that one. So I think a lot of it has been globalization, has increased exposure, and also our traveling is so much more than it used to be, and so forth.
Okay. And any thoughts about ways that you've seen that work well for addressing parasites when they're present?
I think there are two levels. One is when they're obviously present. I like to use things like Malia and golden thread, which are very strong antiparasitics, and also mimosa. The other thing is I think it's very beneficial to include antimicrobials as part of your daily food intake. When you think about most societies, you have groups like in Japan, they use wasabi, which is antimicrobial. In Thailand, they use lemongrass, which is antiparasitic. Oregano in Europe is antiparasitic. Morinda in Polynesia is antiparasitic. I think that most societies have antiparasitics built into their food supply, and that isn't going to be totally protective, but it's going to be partially protective. We've actually been thinking of making a spice line of antimicrobial, good-tasting spices. We just haven't got around to it.
Yeah, no, I think that would be great. Maybe that's why I like wasabi so much. It's helping with something that I didn't know about. What about H. pylori? Any comments on that? Is that fairly common? What impact does it have on people overall?
I do find it in my tests, not maybe 10-20% of the patients that we check. It does seem that certain people, maybe if they're not producing enough hydrochloric acid or for some genetic reasons, they might be more prone to becoming symptomatic. We do find that most people who get it seem to contract it from poultry. I remember CNN had a news story a couple of years ago on Helicobacter, and that about 80% of the poultry population was infected, they said. And it didn't matter if they were organic, not organic. And so I think we're getting, again, exposed all the time if you're using chicken or eggs. They even found that, if you just put the chicken on your counter to cut it, that the Helicobacter can proliferate in your kitchen for a long length of time if you don't do anything. So usually our H. pylori patients, we take them off of poultry and eggs, or if they, insist on eating it, we have them not eat it out. And if they eat it at home, they have to wash every surface that, the chicken or the eggs has been on afterward with something that will be antimicrobial, maybe some essential oil blend or something like that.
Wow, very interesting. Yeah, I hadn't heard the connection to poultry before, so that's good. Anything unique about some of the co-infections with Lyme, the Bartonellas, the Babesias, anything there clinically that you have observed?
Clinically, in terms of treating them, I think with Lyme in general, we find that compared to certain other problems, that the antimicrobials tend to switch, that a person might, need one, say, Malia for a while, and maybe a week or two later, their body wants something else. And sometimes also your body might want to break. It might be we've killed off enough stuff that we've made some toxic mess inside your body, and we need to clean it up with some Taka Sumi or Kamu or something like that. Or your body might want to be exposed to more organisms. It might want to break down some biofilms because it feels like it has the energy to go with it more. So it's more that we see things shift a lot. I mean, obviously with Bartonella, if the person has any cats, that could be problematic. But it's just so you have to keep closer tabs on these folks to make improvement in some of them. Some of them respond really easily, just the way we treat other microbes. But some people, it's advantageous to see them quite often.
Okay. I know we've talked about some of the microbial support options, Morinda, Malia, Golden Thread. And what are some of the more common things that you tend to use with patients? I know that there's a lot of great tools in that realm from Supreme.
I definitely look at Golden Thread and Malia as being the two strongest ones.
Okay.
They're all equally broad spectrum. Morinda, I do use a lot of Shazander, which is a great liver support, but it's also a great antimicrobial. Scoodle Air, which is broad spectrum but tends to focus more on fungus. Mimosa, which is broad spectrum, but it tends to focus more perhaps on Borrelia and different parasites. Elysium is the starting material for making Theraflu. So a lot of people will utilize it for viruses and so forth. Vitalgar, which is chrysanthemum, some of the Lyme docs have found it very effective in treating. The company tends to make lots of antimicrobials because at this point in time, it's almost like you can't have too many antimicrobials in your armamentarium to treat people.
Yeah, absolutely. Totally agree. Yeah, I love Golden Thread and Morinda. I think those are probably two of the ones I've used myself over the years quite a bit and really benefited from. What about die-off reactions? Do you think that when people have die-off reactions, it's because they're doing too much killing, or what's the reason they're experiencing a Herxheimer reaction in some cases?
Okay, I think people are a lot of times mislabeling die-off reactions. I think, like, let's say you have a particular microbe and you take a particular product that is effective against that microbe, but it's, say, from a kinesiological standpoint, it wouldn't have tested well. You might simultaneously, to starting to kill a microbe, have some type of negative adverse reaction to it that could cause headaches and fatigue and brain fog and all these other symptoms. And we'll tend to call that die-off, but it's actually a reaction to the product the person's taking. When we specifically test and give the people what they need, it's very rare that people have what you would call a die-off reaction. Occasionally, 3 or 4 days into it, they have a day where they're feeling a little bit off, but typically people start improving and not getting better. But at the same time, a lot of the herbs that we're giving are also acting as liver support and adrenal support and so forth too, because of their broad spectrumness. So treating that way, it tends to minimize things. And again, at least in our practice, if someone comes in because they're having a negative response, it usually means that it's time to switch supplements because their body has reached its limit on taking that one.
Okay. Great insight. What do you think about the use of enzymes for biofilms and hypercoagulation, and how do you deal with this? I remember you had a good prison analogy from one of the conferences with the prison guards.
What happened to me was about 6 years ago, I ended up with pulmonary emboli in every lobe of my lung from what I think was Lyme, and I almost died from it. And things were going okay. And a few years later, because of a Morton's neuroma that I had, I started taking some enzymes, serapeptase, nattokinase, those kind of things. And suddenly I got a relapse of the acute phase of whatever that febrile illness that caused the pulmonary embolisms a few years before, and I ended up with pulmonary embolisms a second time in every lobe of my lung.
Wow.
And I think what happened was the enzymes broke down biofilms and let loose those microbes into my body, and I became symptomatic again. So what we found, if you read the literature, the other things that are really effective against biofilms are essential oils. And so we formulated 2 different blends of essential oils, and we found that because not only did they break down biofilms, they also kill microbes. So to me, as you were saying, giving an enzyme would be like, if there was a prison, giving the enzymes would be like opening up the prison doors. It just lets everything loose. It's like breaking down the biofilms, just like letting everything loose, while giving the essential oils would be like opening up the prison doors and having a guard with a gun standing in front of every door, because it'll let things loose, but it'll also help kill them. And we were very surprised that topically we were able to break down biofilms, that the absorption would be good, even though there was good evidence of that because they've been treating biofilms as early as the book of Leviticus, which I wrote a book called God's Preventative Medicine that talks about that. But topically was enough to get a good response. And as Dr. Stephen Fry has recommended, occasionally in bad biofilm cases, you temporarily need to reduce the fat in your diet and also the mineral and vitamin supplementation, because both of those can encourage biofilm growth.
Yeah, very interesting. Some of the common things that I hear from people is that they're fatigued, they're brain fogged, and they're in pain. So what can you tell us about how to approach these kinds of patient issues? How do we get people more energy, more clarity, and less discomfort?
Most people with brain fog and fatigue respond very quickly when we get them off the foods. I mean, that occasionally, if they're reacting to almost every food, they might need a zinc supplement because their body's not breaking down cholecystokinin, and zinc will help do that, and that can cause brain fog. Fungi also are big, so it's very, very rare that when we clear some of the easy to clear microbes and we take them off the foods, that those symptoms don't clear. Sometimes in some women, and occasionally men, but much more in women, we need to add L-tyrosine or mucuna to help pick up the energy part of it, since those are precursors to making epinephrine. And if they've had a lot of stress in their lives, their epinephrine levels might be really depleted, and just giving the raw materials to just catch up might be necessary too.
Yeah, and I'm guessing you don't have too many patients that haven't had a lot of stress in their life. Unfortunately, it seems like that sets the stage for a lot of these problems that people experience.
Right, but a lot of times people, when you take them, when you start treating everything and you put them on a whole foods diet, a lot of times their body will just spontaneously bounce back. It'll be so happy that things are removed, and it'll start extracting the nutrients better from the whole foods they're eating. And a lot of times you might not need to supplement with, quote, energy producing substances. So, sometimes you do for a short period of time.
Yeah, I think when we take away the foods, it's happy that we stopped abusing ourselves, and so then it can focus the energy on healing and other things rather than dealing with those food reactions. It's pretty
right.
Pretty
and if you think about things like, look at epinephrine. If you have an acute allergic reaction, what do you take a shot of? You take a shot of epinephrine. So if you're eating a food that you're sensitive to, you could theoretically be depleting your own epinephrine, which is responsible for some of your energy, and you'll be fatigued. So you take those foods out, and the body can utilize epinephrine for energy as opposed to for just dealing with, the food mistakes you're making.
Yeah, awesome. Great insights. So let's talk a little bit about some of the Supreme Nutrition products. I mean, one of the things that I've liked about Supreme is just that they're really high quality, but also very affordable for people. And so I know that your role in working and consulting with the company has been around quality assurance. I know that Supreme does a lot of the standard assays that are kind of expected, but I know that you also explore things from an energetic perspective. So can you tell us a little bit about that and why it's important?
Okay, first of all, everybody has to do those standard analysis, at least for microbes. For metals, it's optional, but for microbes, it's mandatory.
Okay.
And throughout the whole bottling process, multiple times are those done by every company, as long as it's certified GMP, which every company basically is these days. We decided to take it a step further. And what we do is when it's time to get some raw materials to make a batch of whatever product it is, we'll get it from multiple sources, from all over the world basically, and we'll blind test versus patients to see which ones test the best. If we don't find any, we keep searching basically. But so we're adding like an energetic level to our quality control, which most companies don't, because you never know. I mean, the product might look great on that certificate of analysis, but it might have toxic metals, it might have chemicals which they don't test for. We just don't know all the variables that can affect it. So this brings us another layer of protection. And I think that's why, doctors will call us and say, hey, ashwagandha never worked for me, and now that we use yours, we get great results in patients. It's just because taking that extra level of quality control, has just made a big difference.
Yeah, and I love companies that consider energy and frequency and use those type of tools in putting products together, because I think they do ultimately end up working better in many cases. Another thing that I've noticed about Supreme's products is that you don't use fillers and binders and all of those kinds of things. So is that because people react to them, or what's the rationale behind why the products don't have any of those in it?
There's a few reasons. One reason is, a lot of times they'll use some type of flow agent, like stearic acid or ascorbyl palmitate. And flow agents are fat, and they tend to coat the substances a little bit. And, so if you're coating something, and you don't have fat digestion in your mouth, you have it in your small intestine. So you're not going to have any digestion in your mouth or in your stomach, which is more hydrochloric acid, and pepsin is protein digesting. So you'll inhibit utilization of the product if they've used most flow agents in there. And in fact, they'll use flow agents like stearic acid to time release things, because it does stop absorption. So that's one reason. Also, when we started testing different flow agents and fillers, we would have companies send us the microcrystalline cellulose and the ascorbyl palmitate and all those different things, and we found a lot of times adverse reactions when testing those on patients. We've even gone so far as to test the capsules that we utilize. For instance, some of the organic capsules on the market are derived from fungi, and they test really poorly. So we don't use any flow agents, anything other than the herb that's mentioned on the label. And then we also screen the capsules. So it does make a difference. Sometimes on a patient who you really think needs a product, and the product's in a tablet, it tests really poorly, and we open up the tablet and we scrape out a little bit of the inside active material, and it actually tests really well. But they still can't take it because they're reactive to the tablet or the capsule or so forth.
Yeah, I think it's really critical that companies are creating products that are as pure as possible, and that's one of the reasons why I really like what you guys have at Supreme. It's interesting, your comment about the capsules and the fungi. I think that's an issue as well with some of the enzymes, right? A lot of enzymes are produced from fungus, essentially, and maybe that's another reason why people don't often tolerate some of the enzymes.
I totally agree with that. Most of them are derived from aspergillus or so forth, especially if they're just labeled vegetable enzymes. If they just say vegetable enzymes, it's kind of an alarm that that there's a good chance it comes from fungi.
Yeah, very interesting. So what are some of your personal favorite products? I'm sure you use Supreme products yourself. Which ones do you feel the most drawn to?
I like Taka Sumi because my son discovered it in Japan.
Hmm.
I tend to probably use Kamu a lot, which we haven't really discussed. It
Hmm.
tends to calm down allergic reactions and sensitivity reactions. It tends to be a great antioxidant. I do, like you said, the antimicrobials are always utilized a lot, especially Malia, Morinda, Golden Thread, Shazandra, Scoodle Air. I used to use Scoodle Air a long time ago with children, and then we stopped being able to find any that tested well, and recently we were able to find some, so I'm really happy that that's back on board. Those are probably the ones that I utilize the most. I mean, again, every patient is different, and over a course of treatment, there might be 6 to 8 different things that someone might take over a year's time. But those are, Dan Shen, because hypercoagulation is such a big issue for people that have microbes and metals these days. And Dan Shen is a great anticoagulant and nitric oxide enhancer and all kinds of other things. I really like Dan Shen a lot.
So many people these days deal with histamine issues and mast cell activation syndrome. I'm hearing these things come up more and more. Is Kamu potentially one of the things that could be helpful in that scenario, or no?
I think Kamu is usually very helpful in that scenario. The
Okay.
other thing is people have to be really careful with probiotics because a lot of probiotics are histamine producers. So, sometimes, and one medical doctor that we spend a lot of time with was saying that a lot of his SIBO cases were due to taking probiotics. And,
Interesting.
and so I think that they can contribute to the whole histamine reaction, and as can methylation defects, because histamine is degraded by 5-MTHF, and it's also degraded by pyridoxal 5-phosphate. So if you're exposed to a lot of electromagnetic fields,
Hmm.
potentially you could have more histamine reactions also.
Yeah, very interesting. It's a complex web.
Or if you're taking different xenoestrogens, because that'll deplete your pyridoxal 5-phosphate levels. So the estrogens in our environment, in different chemicals and different pesticides and lining of cans and, the teeth linings that the dentists do and so forth, they can end up depleting different nutrients and make you more sensitive.
What about some of the newer products? I know you mentioned Scoodle Air, and then I think you guys just came out this week. Supreme just came out with the Mimosa, I believe. Any comments you want to share on those products?
Scoodle Air, as we said, we used to use it in young children for fungal issues, and we still do. I mean, now that it's back out again, I like it because it's one of the safest broad spectrum antimicrobials for pregnant women. A lot
Okay.
of times you can't use some of the antimicrobials with pregnant women, or a few of them even with nursing. We list on our site which are contraindicated, but Scoodle Air is very safe in those cases, so I like to use it there. And a lot of times in pregnancy, it's easier to get rid of these microbe issues because, like, the body really is focusing on getting as clean as it can, so it doesn't take as aggressive an approach. So something like Scoodle Air works really well.
And I think that's a good inflammation support option as well, right? That's what I've
It's
generally used it for.
and it contains natural levels of serotonin and melatonin, so it'd
Interesting.
be good for that. Mimosa, it's been on the market from a few other companies as a very good antiparasitic. A friend and colleague of ours, Dr. Fagenholz, was using it on people and found that oftentimes they would see larger parasites come out in the toilet. And so he wanted me to find a brand that tested well. And so, again, we hadn't even thought about using Mimosa, but we gathered different raw materials and found one that tested. We had 4 doctors involved with evaluating it on their patients. So they were all happy with it. So it just came out last night. We're
Great.
anxious to see how it does with folks.
I'm always excited when there's a new tool from Supreme. That's great. Any final comments you may want to share? How can people reach you? How can they learn more about your work, your teachings, your conferences?
I do have a website, michaellebowitzdc.com. It's michaellebowitzdc.com. We have DVDs of our latest class that we taught in Seattle, so you could learn the whole protocol that we utilize on the DVD. My son Noah, who has a practice in Tacoma, is teaching one-on-one seminars. If doctors do better, just one-on-one. If they're not quite as sure about their muscle testing, that would be a good way to go. We also put out, as Scott, as you've mentioned, a free newsletter that you can sign up from the website and so forth. Basically, always part of it, like with all of us, is a quest to get well. So we're always trying to get that next step in our wellness. So I'm always doing research on all of these things, and all the plants have really fascinated me since they've been indigenous to so many cultures in the world for these problems. And now, because of our being exposed to things more on a global level, we have to avail ourselves of some of these products that, maybe 50 years ago we didn't need to.
Mm-hmm. Yeah, and I'll put a plug in for your conferences here. So if there's people listening that are practitioners that want to incorporate muscle testing and energetic testing into your practices, it's a fantastic system. It's a one-day course. I've taken it twice and learned a tremendous amount. So I would encourage practitioners that want to, have the energetic eyes or energetic insights into their clients to explore this conference. It was really fantastic. This has been a very enlightening conversation. I definitely appreciate the time that you've taken to talk with me and to share information with people today. So thanks for your ongoing research and ongoing information and products and things that you're bringing to our attention, and I look forward to talking with you again very soon. Thank you so much.
And I can say the same for you, for all you do with your website and counseling people and treating people. You've been a blessing to the world.
Wow, thank you so much. Talk soon.